Let's clarify this point. Myocardial stunning, and hibernation. So these terms often appear in exams, but more importantly, my beloveds, they have major implications for clinical decision-making in real patients. So let's start with myocardial stunning. Stunning refers to transient, reversible left ventricular dysfunction that occurs after a brief episode of ischemia, even when blood flow is fully restored. Okay, a classic example is a patient who undergoes successfully angioplasty or recovers from an episode of unstable angina, but still shows regional wall motion abnormalities for hours or even days. The key is here. The myocardium was temporarily injured but not killed, still alive. So cell membranes remain intact, ATP gradually replenishes, and contractile function eventually returns, my beloveds, without any further intervention. Now compare this with myocardial hibernation. Hibernation occurs when the myocardium intentionally downregulates its function to survive chronic reduced blood flow. Think of it as the heart muscle entering an energy-saving mode, standby regime. Here the ischemia is not sudden but long-standing. That heart adapts by reducing contractility to match the limited oxygen supply, preserving cellular viability. Okay, the clinical message is crucial. Hibernating myocardium improves after revascularization because blood flow is restored. In fact, revascularization of viable hibernating myocardium is associated with better survival and improved left ventricle ejection fraction. This leads to the practical importance of distinguishing between these two states and between viable versus non-viable myocardium. Techniques such as dobutamine-stressed echocardiography, PET scans, cardiac MRI with late gadolinium enhancement and SPECT help identify whether dysfunctional myocardium is still alive. But actually, dobutamine-stress test is most common. So why does this matter so much? Because recognizing myocardium stunning or hibernation prevents patients from being misdiagnosed with irreversible heart failure. Many patients who appear to have poor systolic function actually have myocardium that can recover, and your decision to revascularize can transform their prognosis. So, in summary, let's remember, stunning equal to acute ischemia. So we have normal peripheralized, normal circulation, normal flow afterward, but delayed recovery. So we wait, we do nothing. No, we do our job, but no cardiosurgery, no microsurgery, no invasive surgery, everything is great. We have to wait. Stunning, it's an acute ischemia. Hibernation, it's a chronic low flow. Reduced function, so improves after revascularization. We have to do our revascularization procedures. Both conditions, and stunning and hibernation, show viable myocardium, and both can improve dramatically when managed correctly. Is that clear? Great.